Hello, and welcome to the Clinical Educator Information Session. My name is Kimberly Sisto, and I'm the Director of Clinical Education at the Spalding University CoSAR for Kids School of Physical Therapy. I know you're all busy with your days in clinical practice, and we greatly appreciate all you do to support our students and their education as they go out into the clinic and learn with you firsthand. So for those of you that are unfamiliar with our program, we are a newer program and we're in our third year. We're located in the center of Louisville in downtown, and we have a nice new building. Here's some pictures of our facilities. Here's also a picture of our students. We currently have 5 core faculty members and several adjuncts which instruct our students. And we can't forget some very important clinical faculty. It's you. So to provide a little bit more information about our program, we're currently undergoing the accreditation status and should receive full accreditation in spring of 2027 when our first cohort graduates. Our program length is 45 months, so a little bit over 3.5 years. This somewhat elongated program allows our students to have a part-time work position or help out with family duties. We have a hybrid model of education, which means for 3 weeks of each month, our students perform asynchronous learning activities like video recorded lectures, readings, and learning activities. And they also attend synchronous sessions where they meet with a professor for each course for at least 1 hour each week. During that time, they apply the skills that they are learning from their asynchronous content. Students come to campus once monthly for a week lab immersion, where they come in from 8 to 4 p.m. and work on psychomotor skills. Here's our timeline for clinical education. Clinical education starts for our students in the spring of their second year. The students that you'll be working with will be in their third experience, that's 8 weeks long, and is in the summer of their third year. So at this point, our students have really had the majority of the curriculum and are set to enter into all the duties of a physical therapist. So my role as the Director of Clinical Education, the things that you should expect from me are communication. I want to make sure that you receive timely responses, that you feel like you have clear rotation expectations, and you feel like you have a direct point of contact for any concerns that may arise. Also, my role is to prepare students. My students will arrive ready and they will have objectives and professional expectations that have been clearly set. I also am a person who needs to provide development opportunities to you. So I let you know of opportunities for CI and CCCE credentialing, as well as continuing education and ways to improve your clinical instruction, as well as recognition of you for your efforts. Also, I want you to know that I have a duty to ongoingly be present for these courses. I will do site visits at the midterm for all students, whether that be virtually or in person. But my job is to be here to support you and the student to make this a successful experience. Please don't hesitate to reach out anytime, as my role is to make sure that you and the student feel supported. Additionally, administrative support is something I perform by updating policies for clinical education, organizing our students' clinical placements, and making sure that all documentation is clear with our clinical sites. Additionally, having your partnership, including your feedback, is incredibly valuable to us. My job is to help link the feedback that you give us about how our students are doing in the clinic, their knowledge and academic preparation, as well as areas that we could improve in our curriculum to help improve our overall education to our students. Your feedback is truly valuable, and we appreciate you as educators and not just placement sites. We know you do all of these things already, but just wanted to review some of the expectations for clinical teaching effectiveness. The first is orienting the student to your clinical insight, as well as your expectations. By having those introductory conversations with students, it really helps them to understand what you're expecting from them and how you progress, as well as how things work, which can help them to really excel in the setting. By providing a learning environment that really encourages clinical reasoning through questioning and professional growth through role modeling, this can really impact a student's ability to progress throughout their rotation. By providing constructive and timely feedback, students can really develop more fully. Thinking about making sure that you're giving the student regular feedback, whether that be directly after an interaction with a patient or during a debriefing session after lunchtime, or even at the end of the day. Additionally, we expect that students will begin in more of a supervised and guided manner around patient care and progress to more independent practice with assistance from their clinical instructor as needed. Additionally, making sure that clinical instructors, SCCEs, and the students all engage in regular communication, as well as me, the DCE, regarding any concerns or progress that the student is making. Last but certainly not least is completing required student evaluations, which gives me documentation about how the student is progressing on their rotation and their levels of skill performance. In this slide are the deliverables and the things that we expect our students to complete before they begin their clinical rotation. The first is site-specific health and compliance documentation. This is submitted to me through Exact, and I provide a profile link to the SCCE with this information. If any of this information is incomplete, as a CCE, please reach out to me and let me know as soon as possible so I can help facilitate this process. As a CI and CCE, you should be expecting an email from our student within the next few weeks, just reaching out to introduce themselves, confirm their placement site, and ask information about their schedule, what attire they should be wearing, and any special material that they should review before beginning their rotation. Students will also be submitting the days and times that they will be working with their clinical instructor in the clinic. During their clinical rotation, students will be responsible for performing an in-service or clinical resource that helps your clinic. This is something that you and the student can choose the topic of or the resource that would be helpful to provide to your site. A CI details form, which is something that the student will ask you within that first week, just specifics about your background as well as your clinical site. Students will also complete a patient log that keeps track of the patient diagnoses that they see, as well as the ages and any interprofessional practice that occurs. This helps with our accreditation. The student will also complete the CIET, or what's equivalent to the CPI. It's the evaluation tool that we use to determine student progress in their clinical rotations, which I'll be discussing in detail shortly. Students will also complete the PT student evaluation of clinical site and of clinical instruction. Lastly, they will do a reflection paper for me about an ethical dilemma that they experience in the clinic. Students are not expected to engage necessarily with their clinical instructor on this, as we want them to reflect personally about an ethical dilemma. As a CI, here are the deliverables and the things that you will be completing as you instruct our student through this rotation. Please note that I have a course survey following this that I will send you a link to. Additionally, if this is your first time filling out the CIET for a student, you will have a quiz that will hopefully appear in Exact. I've had some CIs say it didn't always appear consistently when it was their first time doing the CIET. You'll complete the CI midterm and final for a student, as well as an in-service presentation or project evaluation. This is a very brief questionnaire just to make sure that the student completed the in-service or project and it was to your liking, as well as an evaluation of me and my abilities as a DCE. All right, so the CIET, or the Clinical Internship Evaluation Tool. So this is a tool that was made and developed in 2007 to really evaluate the skills necessary for clinical competence and make it in more of a short, easy to use form than for CIs. As a CI, use the CPI for everything, and I thought it had many great there were a lot of great things about it, but one of the things I didn't like was I felt like I was repeating myself a ton and writing over and over again. So this is kind of a streamlined evaluation form, I think, that clinicians have really found it to be more pretty easy to use, and there's really less redundancy. Generally, it takes less time to complete, and I feel like the scales are really a little bit better defined than that CPI. So if you look at, a study about the feasibility of the use of the CIET in full-time clinical education experiences, when we're looking at these two bar graphs, their results showed that for clinical instructors, they spent significantly less time on the CIET than the CPI. So this is how much they were really spending. Most clinical instructors were spending between 30 or less than 30 to 60 minutes doing that CIET. The students here, it took a little bit longer for them to perform that CPI. But really for the CIs, there wasn't as much of a time commitment. But also, kind of looking down at the graph to the lower right-hand side, the CIs and the students, and both the combined CIs and students there, they all preferred the CIET. There was about 70% that preferred the CIET over the CPI. So, I think that's some information that's helpful and tells you a little bit about why we selected that as a tool that we use to assess our students. So as I talked about, there is a quiz, or there should be a quiz for your CIET. And you are supposed to score at least a 15 out of 20 before you can complete the midterm CIET on the exact portal. Okay, so this is where I get a lot of questions because what happens with the CIET is that the student and the CI can go through this and complete them at the same time. So what happens is the student first has access to the CIET, and before you can fill out the CIET, they have to assign you as their clinical instructor and send it to you. Once a student has sent it to you, you will receive an email with a link to the CIET form where you will be able to fill it out at the same time as the student does. You guys will submit those separately, so you won't be able to see each other's responses. And then at the end of that, you'll meet together to discuss the CIET. So the CIET is broken down into 4 different sections. So the first one is standards for professional behaviors. So those things like safety, ethics, communication are within that. Standards for patient management. So thinking about evaluation, examination, intervention, stuff like that is within there. General comments of areas of strengths and concerns. And then a global rating of student clinical competence. So if you want to follow along, I have a copy of the CIET that I am going to give you a link to. And I'm going to post that in the chat so you can click that if you'd like to kind of look at those questions in the CIET as we go along, just so you have a little bit of a reference. So the first one I talked about was the standards for professional behavior. So those are 19 questions that are related to professional behavior. The first group of them is safety behaviors, which includes health and safety precautions, and then that the student is maintaining personal safety as well as patient safety. Next, professional ethics includes all rules, regulations, ethical standards, legal standards, and professional appearance. Initiative is, seeing that the student is maximizing their opportunities for learning, beginning to problem solve. I'm sorry, didn't do that again, is beginning to problem solve, and seeking out and accepting any constructive criticism. The communication skills is the ability to really verbally communicate with the patients, families, and other healthcare professionals. But it also includes the documentation for students. So professional behavior grading is graded on a never, which is a no percent occurrence, rarely, which means it's less than 25% of the time, sometimes where it's around 50% of the time, most of the time is greater than 75%, and always is 95% of the time or more. So here is a sample CIET on Exact. This is what you'll see on your screen when you're going through. And something I want to kind of point out to you is you'll go through the safety and you'll do your check, whichever one you feel like the student is performing within. But there will also be an assessment area in each section where you can type any comments. So any comments, strengths, things to work on, anything that you felt was missed from safety, you can use that comment area to talk about that.
Kim,
So
can I ask you a question there? So
yes.
I've currently used this with other students, and uh, this midterm rating of whether you meet the clinical performance expectations. At a midterm, is it okay to
Yeah.
say, no, you're not there yet? But and they're not going to get, like, okay, we're yanking you out. Or
Yes, exactly. That's fine to say that because, yeah, if they're not meeting the benchmarks yet, yes, right? That's fine. I don't take it, I really don't pay as much attention to that until the end. That's
right.
my big, red, big signal at the end that, uh-oh, something went wrong. But hopefully far before that, we know that that's an issue that needs to be addressed.
Right. And that's where I usually go,
Yeah.
look, okay, you got room to grow. Here it is, and kind of give you
Yes.
that little stick of, hey,
Nudge.
heads up here, and this is how we're going to strengthen this. So,
Yes.
okay, great.
Very good.
I like
Yeah.
to know that. So that it's
Yes.
not, a big concern
Yeah.
for you.
Right. Yes. Yes. Great question. Um, okay. So next, we'll talk a little bit about the standards for professional behaviors. So by the end of the rotation, so these are kind of our benchmarks. So we're expecting by the end of the rotation that the students are scoring always on the safety, professional ethics, and initiative, and then most of the time for communication. So that's kind of what we expect them to be at towards the end, at the end of this rotation. So standards for patient management, as we talked about briefly a little bit earlier, examination is things like your history, your systems review, tests and measures. It's going to ask all those questions about that. Evaluation is kind of looking more at their analysis, that synthesis of, the data that they received during the examination. Can they identify those impairments and functional limitations? Did it again. So then going into the standards for patient management, looking at the diagnosis and prognosis, the frequency and duration of care, and then that criteria for discharge. And then those interventions. So that's going to be things like treatment, patient education, monitoring our patient response, and adjusting accordingly when an outcome has been achieved. Okay, so for patient management grading, we're looking at comparing the student to a competent clinician who is able to skillfully manage patients in an efficient manner to achieve an effective outcome. So we do that by grading them as well below at that level for familiar patients, at that level for all patients and above. So this is where we kind of get in the weeds, and I have the definition sorted out for you all in the upcoming slides. But it's really important to remember that we're looking at, when you're looking at this definition and of well below at that level for familiar patients, at that level for of all patients that we're thinking about and really centralizing, we're comparing that student to a competent clinician that really is efficient and effective in their care. So I'm going to talk a little bit about that familiar patient first. So this is kind of the areas that we're going to hopefully see our students end up in, that familiar patients or complex patients that they're at that level. So a familiar patient is somebody that you see frequently in your setting. Maybe you've evaluated and treated them more than once, and that the student has been working with maybe for a while. This is something that was covered in their curriculum, and the student or in their really isn't a complex medical history with that patient, or they don't have complex needs and care from you. So an example of that, maybe in the inpatient rehab setting, is just that it's an ambulatory, stroke patient with no or few, medical conditions that really affect their care. So a complex patient is a patient who has a complicated course of care and, um, really has complex medical history. So things that this may include is like a problem or a diagnosis that, is not very frequently seen in physical therapy, or, something that student maybe didn't cover in the curriculum. So an example of that may be somebody, in the inpatient rehab setting, somebody that is, a high level, a severe stroke, or somebody that has, traumatic injuries and maybe has some respiratory complications along with multiple fractures and a lot of precautions that need to be followed. So those are, some different um, areas where and things that you would see in a complex patient. Do you all have any questions so far about the difference between a complex patient and more of a familiar patient? Okay, great. Okay, so what our expectation is really for our students to be at that level for familiar or all patients by the end of this rotation for that standard for patient management. So when we think about at that level for familiar patients, that means that the student by themselves independently is at the level of a competent clinician, able to manage patients with a familiar presentation. They may require some supervision, though, to manage those patients with more complex presentations. And then for those students that are able to get to the level of at that level for all patients, that would be a student that independently manages patients with both familiar and complex presentations. So they really are at that entry level, right? Where they're able to see any patient with any condition. They really carry an appropriate caseload for that clinic and achieve an effective outcome with their patients. And they're at that level of, a competent clinician in your setting. Okay, so next, above would be considered at that level for a competent clinician in your clinic. Their clinical skills would be highly effective. This would be way above entry level. And they really demonstrate, skills that are consistent with the most current evidence. They have a higher than expected caseload. They actively seek out opportunities to develop and, look for independent learning opportunities. And they're a mentor to other students and provide support to others. So below, so students that are considered below, that level of a competent and effective and efficient clinician would be somebody that requires supervision or has difficulty with time management while completing, whatever that selected item is for all patients. They would need guidance for those complex presentations and then supervision for more familiar presentations. And we'll go over those definitions of guidance and supervision shortly here. So well below is a student who requires guidance from a clinical instructor to complete any item, so anything that they're being assessed at for every patient. So here is a table talking about those levels of CI support, which I referenced a little bit earlier. So really for those students that require guidance, that's really when they require, direction for all evaluation and treatment. And the CI is really right there helping along the way, the student along the way with their evaluations and treatments. And a lot of the decision making is involves the CI to help guide that student. For supervision, the CI really is more monitoring the student's technique for errors and then helping with decision making as needed. But the student is really carrying out the evaluation and treatment independently. And their decision making is correct, but they may need some direction and cueing a little bit. But generally, the student is able to, go through evaluation and treatment with some guidance. And then that independent student really is able to direct evaluation and treatment and achieve those effective outcomes. Their decision making is competent and they're able to self-direct. So they're not really relying on that CI for that clinical decision making. Um, and then, as a CI, just, you being in that role for consultation, and helping to clarify clinical decisions if a student feels, unsure. Any questions so far? Because I know those can be confusing definitions. Great. All right. So, our expectation is that by the end of the rotation, our students, receive at least supervision, but with some independence for skills. So, this is their third rotation. They're going to be going out into their fourth rotation next, and be expected to really be at that entry level. So, leaning towards being more and more independent with all of these skills. Okay, so there's also an area for overall comments. So thinking about those areas of strength and opportunities to grow. So that's kind of where the student and the CI both have an area where they can talk about that. Next, a global rating of student clinical competence. So there's a rating scale from 0 to 10, and 0 is well below a level of a competent clinician, while 10 is above a competent clinician. So what we're really looking for is that our students show improvement from their midterm to their final. And then there's also a question after that says, is the student performing at a level that is satisfactory for the current level of education? So that's also important to help us know, if you think that they're adequately performing for where they are in the curriculum. So I know that was a lot going over that CIET, but do you all have any questions? Okay, I'm here to be a resource throughout this. I'm going to show you guys some more resources as we go through. Um, as we go through this presentation, an area for additional resources, and I'll help send those out to you at times when you will be utilizing those to help you with this. But please don't hesitate to reach out if you have any questions, especially if you're using the CIET for the first time. All right. So I just want to go over some of our general policies and procedures and stuff, just so you all know the big high points when to reach out. So student attendance. So we're expecting our students, and they know that they're supposed to arrive before their identified start time. And if they are late, running late, sick, or unable to attend, they must reach out to both their CI and me, the DCE, before that identified start time. Students are expected to be prepared at the start of their workday and at their start time. So, if they start at 8 is your start time, they should be there ready to go and have all their tools and things that they need for the day. They're expected to work the same hours as their CI, including weekends and holidays, unless that's otherwise approved. So, let me know if you guys have any issues. The students have been instructed to let me know if there are any variations in schedules, but they're really expected to work your hours. Um, our students are expected to complete 320 hours of clinical practice with their clinical instructor and physical therapist and performing PT related duties. But if students have any issues meeting these expectations, please reach out to me as soon as possible. All right, a critical incident is something that I hope will never happen, but this occurs when there's a serious breach of professional behavior, ethical standards, or patient safety. If you feel like any of those things have happened with a student interaction, with a patient, or with you, please contact me immediately. We'll determine next steps, and how to work through that problem and process. So I want to include our non-discrimination policy, which is just to make sure that you know that our students are upheld, to make sure that we do not and know that we do not tolerate any harassment or discrimination based on race, color, national origin, age, disability, religion, sex, pregnancy, sexual orientation, gender identity, military status, or veteran status. So if any of that harassment, unprofessional behavior occurs, I need to know immediately, because we do not tolerate any of this in the working environment. So this is where I talked about some helpful tools and resources. Let me go into that for you. So I have a site resource page, which I'm going to show you. I'm going to share my screen here and show you, and I'm also going to give you a link to that in our chat. So I'm going to link it right here so you can look at it. And I'm going to show it here so you can see. I'm like, share my screen here. Okay. So right here is our Spalding University site resource page. So I'm going to go to our homepage, which you guys will be able to see. We have general resources here for all the program, and then specifically for clinical rotations. There's also a clinical education schedule and contact information for us. But I'm going to go under the core specific information because that's where you'll find most of the things that'll be most helpful for you during this rotation. So this professional practice 3 is a place where you can find all of the information for this clinical rotation for our students. So I have a clinical instructor handout, which was sent to you all a bit earlier, which has information just about the courses that the students have taken in the curriculum so far, our communication policies, any tasks and due dates that we talked about a little bit earlier, also our CIET benchmarks that we talked about earlier, our workload targets. So, having our patient or our students kind of manage about 75% of a physical therapist caseload at your site, being able to independently and evaluate treatment and treat patients with familiar presentations with minimal to no queuing by the end of that rotation. And then with more of those complex presentations, they're doing the treatment and evaluations were moderate to minimal queuing. So it has a student tasks as well. So it's just meant to be an overview of all of these things that we discuss here in our presentation. There's also a video about how to fill out the CIET using EXAT, the CIET performance benchmark. So that's kind of what we're expecting our students to score on the CIET as they go out throughout the curriculum. Our clinical educator handbook, so that has our policies and procedures. There will be a link to this video on our Spalding University DPT clinical educator training session um, YouTube channel. There's also a professional practice. Oh, and here I am again using, oh, here. And then there's also a link to these PowerPoint slides from this presentation. And then our CIET definition. So that's, I'm going to just show you that real fast so you can see that. So really it has those definitions that we talked about what the different areas are in the CIET, but then here's those definitions for familiar presentation, complex presentation, the guidance, the supervision, independence, all of those things that may help you a little bit to guide you a little bit more when you're filling that CIET out. Um, so yeah, so that is all the resources really for this rotation. Now, when we look at our program-wide resources, there's more training resources for the CIET. So there's a training video that was done by the University of Pittsburgh if you want additional training information. There's also some articles about the CIET here. But there's also teaching resources here. And these teaching resources are meant to provide things, that may help CIs as they go through to become better teachers, right? Help with facilitating that clinical reasoning. There's a free course from the University of Michigan about teaching and assessing clinical skills. So these are just lots of different resources to help improve teaching and clinical teaching. And then there's forms here. So here's a student goal writing worksheet, and I'll just show this real quickly. So this is just helpful for the beginning of the rotation when you're having that initial conversation with your student. Just, where they can write their goals for the clinical experience, and you can write, what your goals may be for the clinical experience. But they may share this with you and talk about how they like to, have feedback. Or this can just be used as, something to really guide your conversation. Areas of strength and then areas of development. So there's a weekly planning form. So there's this weekly planning form that we have, as well as the one that's on Exact, or if you have one from a credentialing CI course, you can also use that too. But this is just to kind of give you that weekly overview of how things are going and then set any goals for the upcoming week. So if you prefer to do that on paper, here's your paper document, but it's also an Exact if you prefer to have an electronic version. Here's our critical incident learning plan instructions, but hopefully that won't be an issue. You'll contact me before we even have to worry about going through all that stuff. So I won't make you dive into that now. So next I'm going to go back to my presentation here. Any questions so far, though, about anything that we've covered?
Nope, sounds good.
Okay, great. Let me go back. Oh, it's giving me a hard time right now on my presentation. Okay, so I'm going to come back and screen share here. Okay. So, suggestions for a successful rotation. So, the big thing is, like we talked about, starting with that communication, constantly communicating, talking about goals, expectations, ways that that student may communicate best, way that you like to communicate with students, doing regular debriefings, having that student plan their interventions. I talk a lot to my students about the importance of planning, knowing what they're going to do with their patients before they walk in the door or before the patient walks in the door. And, maybe even reviewing that with you as the CI before the student works with the patient. Just making sure you guys have directed goals can be really helpful for each week or even each day. Hey, I want the focus today to be on this examination technique or this during treatment. That can really just help the student give the student a little bit more guidance about how you'd like to see them progress. And then the student experience. So, any opportunities at your facility that they may have to see other specialty areas of PT practice, work with other disciplines, whether that be speech or OT or doctor, surgery, multidisciplinary clinics, anything like that would be incredibly helpful to the student as a learning experience. And then, involving them in the supervision and coordination of any support staff, whether you have aides or PTAs or administrative support. It's really important to help give those students a taste of what it's like and understand how to really interact with those different professionals. So when they go out to be PTs, they can do that on their own. So don't forget to include that. Something I always suggest to CIs if you don't have, aides or support tech, maybe just role playing and say, hey, if I were a PTA or if I was an aide, what would you tell me to do? So site visit. So for a site visit, I do this with all of my students throughout their, during their rotation. So we'll either do that via Zoom or in person, depending on your location. But I'll visit halfway through the rotation and we'll, just talk about how the rotation's going, anything I can provide support-wise to you or the student. And, if needed, I'll do follow-up conversations and assist with any problem resolution. So everybody likes to do things a little bit differently for these site visits. So how do you guys prefer to have site visits structured? I'm going to go back to screen share and see if I'll go back. Oh, here we go. I'm going to go back and share my screen to the other screen and see if you can see on my slide so you guys can respond here a little bit better. Share. All right, here you go. So this is just asking whether you would prefer to have site visit structured where I meet with the student and CI together at the same time, whether I meet with the student and CI separately or meet with the student and CI separately and then together as well. Or it depends on student performance. Very good. So it looks like we've got some various different, um, you know, different needs. And I think, truly it can depend on the CI. So what I'll do is I'll send out an email to you before we meet. And the student just to see, but I'll give an opportunity for each of you to discuss with me and if you want to one-on-one, and then we'll also meet together. Um, and then let me know though, if you do have any preferences, don't hesitate to reach out and say, hey, I really feel like, we just need to meet one-on-one, or anything like that. I'm happy to meet in whatever way works best for you. All right. So I'm gonna go on. So here's my contact information. Um, Never hesitate to reach out to me. I'm here to be a resource to you. If you're ever questioning if you should reach out to me, please don't hesitate to reach out. Um, Text, call me anytime. My email is up there, and I do my best, especially when students are out on rotations, to be very responsive to those within a few hours. I'm regularly checking my email. So without any anymore. If you all wouldn't mind giving me some feedback about this session to let me know what was helpful, what you would like more instruction and information on, things that I could have left out, that would be super helpful for me. So I will send that form to you, and I will also put that in the chat.